Good afternoon. It's 11 a.m. Eastern Standard Time on Wednesday, June 17th, 2020. This is a KBeam's COVID-19 EMS Administrators Conference Call. The conference call will be recorded. My name is Chuck O'Neill. I'm Deputy Executive Director for the State Board of EMS, and I'll be turning things over now to the Executive Director for KBeam's, Mr. Michael Pointer.
Thanks, Chuck, and thanks everybody for taking time to join us today. I know if I count right, this is day 101 that we've been involved in this pandemic, and I really feel like we've got a ways to go yet. But we thought it would be good to reach out and communicate with you. I know for a while we had weekly calls. I think from this point on, even pandemic or no pandemic, I think we're going to continue to have the monthly calls. We've had a lot of good comments on being able to ask questions and communicate. So we'll just plan in the future whatever operations we have, we'll continue with the monthly calls. So what we'll do today is we'll go down the line just like we did before with the different divisions and directors and give sort of an update since we last communicated. So I'll turn it over to Paul Phillips, our Director of Field Operations. Paul?
Thank you. So one of the things I wanted to update you guys on was the personnel accountability report. I'm going to do this most weeks. We've missed a few weeks, but here we go. So first off, I think you guys are doing a phenomenal job about maintaining your PPE and maintaining your levels. I don't know how you do it, honestly, because I know you all are doing more with less than we've ever done before. But with that said, we have 160 agencies that have reported this week. I'm pretty sure, as I usually say, that there's more than that because some of you manage more than one agency, so you only submit numbers for that one agency, which is fine. But we have 6 EMS providers that are quarantined and 6 that are in isolation for a total of 12. Which, if you look at how many people we have on the streets, is really a phenomenal number. From my viewpoint, I think you guys are doing a fantastic job. So pass it on to your folks. Keep up the good work, and also continue your diligence about maintaining your PPE. I know we're loosening some restrictions socially, but I think for all our intents and purposes, from the EMS standpoint, we need to maintain that high index of suspicion. So just keep up the good work, guys. My second item is we have resumed inspection, on-site in-person inspections as of June 1st. From what I'm hearing, they're actually going pretty well. We have put out some guidance for how those will look a little differently. One of the things is your inspector, when in your building, and ambulances will be wearing a mask. We are screening ourselves for any symptoms. If anybody has any issues, we're going to let you guys know, hey, we're not coming. So you don't have to worry about us entering your building if we're having, especially signs and symptoms of COVID-19. And then, we're asking for the same back. If you guys have anybody on site that has any of those symptoms, hopefully they would have gone home by then, but if not, then please let us know. And the contact for our folks, and to make sure that we're as safe as possible for you all and for our staff as well. There is a guidance document on our COVID website at kyems.com. Click there at the top to get to the COVID website. And it is conducting agency and vehicle inspections during the COVID-19 pandemic. And that gives you complete guidance on how we're going to conduct inspections going forward. Who knows how long this is? This may be the new normal. So just like we said, hang on for the ride. I also wanted to update a little bit on the civil unrest guidance that we've sent out a couple of times. I've gotten some calls and some questions from folks about specifically Louisville, but also there's been some questions about Lexington and including Nashville as well. Specifically to Louisville, we received guidance from Diane Vogel last week that they are not standing up that call center or that number that they had unless there are issues. I would ask you just to go ahead and call that number. If you don't get an answer, reach out to Louisville MetroSafe. That's the dispatch. They can get you any information. I would recommend that you do that before you transport, and then once you get 30 or 40 minutes out, you would probably reach out to them as well. And that goes for any of the cities. Reach out to their dispatch, reach out to your receiving hospital, just to get guidance on if there is anything going on in the city, especially if they told you before you transported that there was. As we've seen in Louisville, sometimes these crowds tend to travel. So even if you called 2 or 3 hours before and they're like, yeah, something's going on, but it's at XYZ location, you may get closer and it may be at ABC location. So just make sure you're reaching out to the receiving hospitals or to the dispatch there in the local areas, and they can help you make your determination on how you're going to move forward. So, Mr. Pointer, that is all I have for now.
Thank you, Paul. Next, we'll move over to an update on certification, licensure, and education with KBEAM's Director of Education, Certification, and Licensure, Bob Andrew. Bob.
Thank you, Chuck, and I'd like to thank everybody for keeping your community safe during these difficult times. We're doing everything we can here at KBEAMS to assist you with doing your job. Processing applications, we're back to our 1 to 2 business day processing, mainly the 1 business day. Of course, our batch processing takes place at 1 a.m. the following day. So what we process today gets processed tomorrow at 1 a.m. and the emails go out. We're mailing cards as we can get into the office and print them and get them out, not under the normal schedule. So there'll be a delay in the cards in receiving those. But in the meantime, you can use your PDF copy of the card that you'll find in the document section of your ChemSys account. You can print that and carry it with you. As far as the emergency reinstatements go, they expired on June the 9th of 2020, and the reinstatement process has changed back to the normal reinstatement process in our existing regulations, which those can be found at kyems.com. Click on Legal in the gold banner, go to Administrative Regulations, and you'll be able to find the existing regulations. Background checks, Castle Branch is who we use for our national background check for folks that have never been certified with KBEMS, and there have been extended wait times for the county checks due to the COVID-19 pandemic. We have asked them to, when needed, to use the statewide background check in lieu of the county check. We're processing the background checks that way, and they're being expedited, so we're not seeing any huge delays there. The temporary applications that we issue, just to remind everyone, the temporary certification or license is the only one that has a time restriction on it, and it's good for 1 year under the emergency regulations. This is mainly used by students who have completed their initial EMS training and have not been able to test with National Registry due to the COVID-19 issues that Pearson VUE is having. The training center is able to verify their course completion on a COVID-19 EO1 form. However, we still require verification of course completion with the TEI through the normal E23 and E25 course completion forms. I bring this up because there's been significant delays in EMS training centers submitting these course completion documents that are normally required for us to verify student course completion. Once these are received, we process the temporary applications. The students would need to complete their National Registry certification before their 1 year expiration date and to apply for their normal certification through our CHEMSIS. The 2020 EMS provider renewal process is expected to open July of 2020. And we just want to remind everyone that K-Beams accepts 100% online continuing education from any EMS training site. And that's, the board on June the 11th approved the Kentucky EMS oath. And you can find that on our website at kyems.com. Click on About in the gold banner and scroll to the bottom, and you'll be able to download a copy of that. And that's all I have, Chuck.
Thank you for the update, Bob. We appreciate it. For my update, again, certification and licensure renewal for 2020 is tentatively scheduled to open on July 1st, 2020. I wouldn't expect any hiccups or slowdowns on that process. So again, this year we will have that open for a 6-month period. So for those of you folks that have had stragglers in the past, let them know that it will be open on July 1st. We want to get those done as soon as we can on those certification and licensure renewals. Criminal background checks have been received by the office, and they've been screened on all potential renewal applicants for 2020 and are currently being screened. So we should have those screened prior to that July 1st, 2020 go live date. Just some updates for you. We're getting back to some normal ops in addition to monitoring the COVID-19 situation here at K-Beams. The K-Beams Cares position hiring was placed on hold due to the COVID-19 pandemic. Interviews for that position will be conducted using video conferencing and are being scheduled at this time. That's for the Kentucky Cardiac Arrest Registry coordinator position. From reviewing volumes, it appears EMS volumes across the state appear to be slowly returning to a common benchmark. With that volume comes additional potential for EMS exposure to COVID-19. It's important for us all to remember that COVID-19 is not gone. To the contrary, we're seeing case escalation with reopening of business and industry. Please remind your staff to screen patients for COVID-19 and utilize appropriate PPE on every response, whatever that appropriate PPE may be based upon their screening and assessment of the patient. Please encourage enhanced safety practices at your agencies as we encounter both the COVID-19 pandemic and civil injustice protests across the state. Make sure that your crews are using good scene safety practices. On the regulatory front, 202 KAR 7555 ground agencies, which will modify a radio requirement for the patient compartment in the vehicle, was heard at the Administrative Regulation Review Subcommittee in June, and we expect it will be assigned to committee in July next month. Also, 202 KAR 7201, 301, 330, 401, and 601 were filed with the LRC on June 11th. Those are the certification and licensure and educational regulations. Public comment for these regulations will be open from August 1st to August 31st, 2020. And if you'd like to now, you can enter any questions into the chat function that you may have, and we will do our best to address your questions. We do want to thank you all for attending today, and we certainly appreciate everything that you and your staff do on a daily basis to protect our citizens. Mr. Pointer, while folks are composing any questions they may have, we don't have any in yet. Would you like to go ahead and do your closing, and then if we have any questions, we'll grab one right at the end.
Sure. Thanks, Chuck. I just received communications from Louisville Metro EMS, and they're advising to avoid the area from Market Street to Muhammad Ali and from 4th to 7th. They also said this is where a lot of these civil unrest is sort of stationed, or the squatters basically are. It's around the city hall. It's far west of the hospital district. So you shouldn't have an issue coming from out of town anyway with that, but just to let you know. And again, that's avoid the area from Market Street to Muhammad Ali and from 4th to 7th. We have, and I've mentioned this before on calls, we have a weekly unified command meeting. It was in person for about 8-9 weeks, and this is all the department leads of the emergency support functions from across the state. We're now doing that virtually. We had a meeting this morning, and we had a conversation with Dr. Stack, and he feels that we are in the middle of this event, and I've mentioned that before, and you've probably heard that from some of the news conferences. We're just getting in a position, I feel like we're better supplied, but with that, be sure you have enough PPE for at least 7 days. That's really important. And, I was telling them on the call that, our run volume is starting to return to baseline, and we're using a lot more PPE. So if you have any problems, reach out to us and we'll try to assist in any way. Our office operations, we've been remote since the start of this pandemic. We've only got about 20% of the staff that's in the office right now, and that will probably continue till late July. So if you have any questions or concerns, or if you call or put a ticket in, just try to be patient. We're doing a lot, and the staff, I've got to commend the staff. They've done an extreme amount of work, more than the baseline than we normally do. We processed on this reinstatement program, and correct me if I'm wrong, Bob, but I believe we've had over 1,400 first responders come back online since the opening of that window. So with that, I believe that's all I have on the update. As I mentioned before, I believe this is a good idea that we continue to do monthly calls, even in normal operations. I think it's good that you can be able to reach out and ask questions, and we can pass along to you any current information that we have. So with that, I think we've got a few questions coming in, so I'll turn it back over to you, Chuck.
Thank you, boss. First question I'll give to Bob. Andrew, let me find you, Bob, so I can get you unmuted here. And the question is from Steve Maselli. I was late. The COVID-19 renewals expire June 9th, ? They now are required to have the appropriate CEUs for renewal, ? Bob, can you address that one for us?
Yes. What expired on June the 9th was the emergency reinstatement. That was the change to the reinstatement process that was allowing anyone who had been previously certified or licensed with K-beams to reinstate that by filling out an application and completing a background check, and the fee was waived for the 60 days. That's what expired on June the 9th, and the reinstatement process has went back to our existing reinstatement process that's in the existing regulations. The emergency order and the emergency regulations are under the COVID-19 banner where it says read more. As far as continuing education, in the emergency regulations, we did not include the continuing education in each of the provider regulations. However, we strongly encourage and remind everyone that K-beams accepts 100% online continuing education from any EMS training site. That's it, Chuck.
Thank you, Bob. Next question I'll give to Paul Phillips. Paul, give me a second here to find you. And this question is from Brent Janes. Is there any civil unrest guidance for those that transport to university, hospital, children's, etc. in Cincinnati? We spoke about Louisville and Lexington and Nashville. Paul, do you have any information on guidance for Cincinnati?
Uh, you got me, Chuck?
Yes.
Currently, we do not. I will reach out and see if there's anything specific, and if there is anything specific, I will share it. I will just kind of reiterate. I would make sure that you're checking before and during your transport to make sure that there's nothing presently going on. A lot of these are happening during. Just I would check around the clock if I were you guys. So I'll reach out and see if there's anything specifically. If there is, I'll share it through our usual means.
Great. So Paul's breaking up just a little bit, but Brent, he's going to check in with some folks in Cincinnati, see if we can get any guidance, and then we'll email that guidance out to you folks if we're able to find it. But Paul, the next question's for you as well from Bar Pal in Anderson County, EMS. Where on the website is the new inspection information guidance?
Bart, I'm not sure specifically what you're referring to. There's not a whole lot of anything new. There are some things that just aren't applicable during the emergency orders, which would be basically the medical director requirements. All we're requiring at this point is KBML, and then also for driver's training, that's kind of off the table at this point too. Although, as we've said with all the emergency orders, once this event, specifically once the emergency order is rescinded, everything goes back to the way it was. So although you're not required to have it now, that was put in to allow for the onboarding of new personnel quickly. So once this goes away, they will be required to have all those required trainings.
Paul, is there any, is the guidance that you put together for the inspectors for PPE, et cetera, is that available to the public on the website for the?
Yeah, absolutely. If that's what you're referring to, Bart, it is available. It's on the COVID website on kyEMS.com. Click on that link and you'll be able to get that.
So that's under the COVID link on the KBEMS website. Thank you, Paul. Next question was, I got this one from Joe Migna. And Drew, I'll ask you about this because I'm not currently up, but Joe just asked, he said that he's having some issues getting access to the KEMSIS site. Is there a problem with it? Drew, is anybody up on it right now?
The site appears to be up and running just fine. We did have a change back in April with our hosting provider to improve overall site performance. So if you have an old bookmark, I would recommend that you delete that bookmark and then go to the KBEMS homepage, kyems.com, and click the gold hexagon to make sure that you have the newest address. The old bookmark should still take you there, but that could be part of the problem. I just logged into KEMSIS right now, and everything seems to be up and running just fine. Thank you, Drew. Appreciate it.
And the next question, we had a few problems with the questions were coming through privately. But Paul, this one's for you as well. Let me scroll back down. We got a lot of folks on the call today here. Paul, this is from Chuck Rameen. Has the PPE survey been closed? I couldn't log into it today, and my EM director wasn't aware of any changes. Kaylin, could you please unmute Paul? Because I passed host duties over to you because I was getting the questions privately. Could you unmute Paul, please?
I'm not sure about the PPE survey. That is actually it's a Kentucky Department of Public Health address. I'm not aware of anything that's changed other than they did send out some renewed guidance. I'll find that link real quick and see if I can put it in the chat. But I'll see if I can find that. But I don't know of anything that's specifically changed on that end. If nothing's changed, you may check with your local Department of Public Health.
Thank you, Paul. And I think that concludes the questions that we have for today. So again, we want to appreciate, we want to thank all of you for attending today. We had about 88 participants on. and we sincerely appreciate you participating. And if you have any additional questions that you need answered, feel free to submit those via support ticket or through the K-Beams emails. And we appreciate it, and you all be safe, and contact us with any questions, and have a great rest of your week.